Hello, this is Gaurav Kapoor from Newristics, and welcome to Masterclass number 5 for Behaviors Masterclass series. If there's anybody on who's attended one of these classes before, you know the format already. Otherwise, Behavior is a masterclass series designed to teach pharmaceutical marketers and market researchers principles of behavioral science in a very practical way, so that they can apply it tangibly. Our goal is as soon as the session is over. That may be aspirational, but that's what at least the intent is. Master classes are held every third Tuesday, the third Tuesday of every month at 2:30 p.m. East Coast time. And they're 30 minutes only, but they're standalone. You do not need background in behavioral science. You actually do not need to have attended prior classes as well. You'll be able to learn something new in these 30 minutes. So the format for every masterclass is pretty much the same. We teach 2 decision heuristics or biases in every class. We'll talk about this a little bit more, behavioral science is the science that explains how human beings behave and how they make decisions using mental shortcuts, i.e. heuristics. And this science has won 3 Nobel Prizes at this point in time because it has helped bring to the forefront the idea or how people behave in irrational ways. It has brought this new thinking to the table. Lots of people are interested and intrigued by this science, but they have not yet figured out how to use it on a day-to-day basis and apply it to their jobs. And if they're working in the pharmaceutical industry on market research or marketing type of activities, this science offers them great potential that they can be utilizing. And the purpose of this masterclass is to simply bridge that gap and help you start using it, not just be intrigued by it, start using it. So let's jump right in. The first heuristic we're going to cover today is called attentional bias. We'll first introduce what it is, and then most of the learning in these master classes is done using examples from the pharmaceutical industry and from other industries as well. So
hi, sorry, there seems to be a lot of echo.
Yes, I see. Is that better?
I'm not sure.
Let's try this, and we'll see if the echo goes away.
Yeah, I think that's
what is
better.
Attentional bias? Attentional bias is a bias that we often use to make decisions, in that we are biased to want to pay more attention to emotional stimuli instead of rational data and arguments. Emotional imagery and emotional stimuli of any kind can drive decision making disproportionately more than rational data can. And this bias doesn't work in every case or in every situation, but there are times when it can play a role in decision making and even lead to potentially quote unquote irrational decisions. So as an example, all of you have heard, like, if you want to make an ad successful, you put babies in it, you put puppies in it, etc. Right? Like, everybody knows that as a joke or as a rule of thumb. How does it evoke emotions and emotional imagery and actually has potential to change decisions? That's the part that this science helps understand and explain. So let's dive a little bit deeper into it. We'll show you examples of attentional bias and help you better understand and use it potentially. So here's a couple of examples of attentional bias that you are most likely familiar with. These things happened over the last 2-3 years. A few years ago, there was an image that literally got the entire world's attention. This image of this little baby, a boy who had basically washed up. He was a Syrian refugee from a Syrian refugee family, and in their attempt to try to flee to Europe, he and other people died, and his body was found on the beach. And that one picture got so much attention around the world on this humanitarian crisis that has had actually, frankly, been taking place for years now. But we just never thought about it. We never paid attention to the data and the facts in a way that one picture brought attention to it. There are millions of refugees living in Jordan and Lebanon and other Middle Eastern countries who have taken in refugees from Syria, and many of them are children. And they're living in complete squalor and makeshift conditions in these countries. And I'm sure there are hundreds of studies or reports or articles, etc., written on that, but most people have not thought about it, have not been exposed to it, have not paid attention to it. But that one picture got the world's attention for good reason, and we're all thankful to that. A year and a half or so ago, you might remember there was this beautiful, gorgeous lion that was shot by a dentist from, I forget, Wisconsin or Montana or someplace. And it brought an uproar in the media and in the US. How could he have killed this, gorgeous, like lion? And over the last 30, 40, 50 years, how many lions have been killed by people from around the world? And if you were to actually make a rational argument to people about about wildlife conservation and protection of these endangered species and whatnot, you'll get head nods, but you won't get behavior change. But something like this, that picture, because that line was so just such a beautiful specimen, it got the world's attention, or it got certainly America's attention, so much so that the dentist had to flee to Mexico, right? Because he was worried about his safety, and people were threatening him, and so on and so forth. So it changed people's behavior. It got them to take action, maybe not the right action necessarily, but it did get people to take action. So these are examples of attentional bias, emotional imagery driving decision making more than rational arguments and data should. Let's look at an example from the pharmaceutical. So we're going to look at several examples from the pharmaceutical industry. Here's an example of a drug called Trulane. It's a drug for constipation, chronic idiopathic constipation, or constipation associated with IBS, or those kinds of gastrointestinal conditions. And this is screenshot straight out of their website. And it's a very interesting use of very stylized imagery that is actually simultaneously trying to kind of describe the challenges of living with this condition, and potentially the benefit of the drug using attentional bias. So the left side, the cascade on the left side is supposed to be constipation. The cascade on the right side is diarrhea. And anybody who's suffering from either one of these conditions would actually kind of relate to the emotional frustrations, and it's physical too, not just emotional. But the way these stylized images have been created, they're trying to leverage attentional bias. Let's look at another example. This is a video. Let me just play this video, and then you'll see throughout the whole video how highly emotional imagery is actually being used to perhaps make a much bigger deal of something that the cause is good, but there are many, many other causes that are even more important, and even perhaps higher priority than this one. But it's done in a way that the emotional imagery makes you want to care for it much more.
It's just a little kid in that picture. Yeah. So I told my dad, I said, let's just shave it. I don't want to see it fall out slowly. And I wanted to have that almost one up on cancer. Every time you buy a Hyundai, a portion of those proceeds go to cancer research. To see a company step up and try and fill the gap for kids in need.
So as you go through the ad, you actually don't even know if it's a Hyundai ad. It's building up to something. You don't really know who you think it might be. It might be a hospital, St. Jude's, or whatever, and it's actually Hyundai corporate philanthropy putting some money, putting some money aside for cancer research, etc. But many organizations are doing that. Like if they're not on there, but the ad is designed, it's a corporate PR ad, it's designed in a way so that it is, it's evoking emotional imagery to help reinforce the equities of a Hyundai brand in a very positive way. Let's look at another one. This is an ad for a pharmaceutical drug called Namenda, which is indicated for Alzheimer's disease.
Caring for someone with Alzheimer's means I am a lot of things. I am his sunshine. I am his advocate. So I asked about adding once daily Namenda XR to his current treatment for moderate to severe Alzheimer's. He's always been my everything. Now I am giving back.
And Alzheimer's is
caring for someone with Alzheimer's.
You know, for caregivers as well as the patients, they suffer a lot. There's a lot of emotional roller coaster up and down, etc. Now this is obvious in that you would naturally be, you know, inclined to use emotional imagery in a disease like this. But how you use it to really to tap into the subconscious decision-making mind of the patient or the caregiver or the physician, whoever you're targeting, with while you're leveraging attentional bias. That's basically that's really the subtle you know, skill in how to use this heuristic to your brand's advantage in your communications, how to talk to the customer's attentional bias so that you can get the customer's attention and you can potentially change the customer's decision making in the direction you want to. So that was the first heuristic. There was a bias called attentional bias. Here is the second heuristic of the day. This is also a bias called customization bias. Let's introduce this first and we'll look at examples next. What is customization bias? Basically, people have a strong affinity towards personalization and customization, even when it's not necessarily needed. So people think they want their, whatever they're buying or choosing, if you give them the option of standard versus customized, they almost always want customized, even though their needs oftentimes are fairly basic and they don't need customization more than anybody else does, but everybody thinks they're more special than they really are. And they are willing to spend more time, more money, more effort, etc., to get customized options in certain categories or certain situations in life, which one could argue is not rational. You know, they are kind of sort of, because of this bias, they might be behaving irrationally. They might be either spending too much time, money, or effort to seek customization when they really don't need to. So let's look at some examples of customization bias, again, from outside the pharmaceutical industry and then in pharmaceutical industry. These two brands, if you're familiar with brands or companies, if you're familiar with them, they're both jewelry or luxury, you know, products brands, mostly focused on jewelry. In this case, it's just a side-by-side comparison. If you were to build the Pandora bracelet on top as visualized, it would cost you almost $2,000. So the silver bracelet with the charms, et cetera, versus that David Yurman bracelet would cost you about $1,000, half as much. Now, one could say, well, but the Pandora one is so much more beautiful. And then others could say, I don't know, there's so much going on in that bracelet. You know, I like the much more clean, stylized or stylish look of the David Yurman one. That's obviously totally dependent on personal preferences. But the point here is the brand Pandora, the entire value proposition of that brand is essentially built on this idea of customization bias. Most people are not these jewelry designers. It's very possible that their own choices in how they're actually building their bracelet with charms may not actually create a great bracelet. In most cases, it probably would not. But it's just the fact that the customization availability of that and the fact that, you know, you think you're more different and special, etc., can actually lead you in that direction. And now you're willing to pay 2x and might even end up with not necessarily the most beautiful or greatest bracelet versus what somebody else might have designed it for you. So this is an example of customization bias. Here's also another good example of customization bias. It's health related, but it's not a pharmaceutical drug, but it's something that almost all of you would have seen almost all of you would have seen it in the store. Dr. Scholls many years ago, and they're the only brand in the category in the store that has equipment or a machine like that, and it has been quite successful for them. You stand on it, it takes some measurements on the spot, and you get the feeling that you're actually getting an orthotic like exactly for your feet, just for exactly, I mean, it's not a 3D printer, right? It's not literally, creating an orthotic right there on the spot, that. But there's still very much a sense of, all it is simply, if Dr. Scholls makes 3, 4, 5, 6, whatever types of orthotics, it's just helping you point to the right one. And it's not because of the shape of your foot necessarily as much. That's what it should be, but it's not the only criteria in their case that's driving it. They're also trying to drive you to the most expensive orthotics that they make and sell in the store. So it's a very good example of, is that machine really needed for people to make a choice and buy the right Dr. Scholl's product in the store? Rationally, you may say the utility of that is not that high. Yes, it may help some people, but all in all, it's not necessary. But it's definitely a marketing, like it's a program that they have built. It's very unique, and it's helped grow overall adoption of the category and the brand. In the pharmaceutical industry, most of the use of customization, you are going to find it in on the topic of dosing flexibility and dose adjustment or dose customization for a given brand. So here's an example from an immuno-oncolytic Opdivo, where this is straight screenshot out of their website, and this talks about how customizing, they have 2 dosing options, and really, if you look at it, right, it's like either you dose every 2 weeks or you dose every 4 weeks. So it's not even like in the world of like really truly customizing dosing, or having many different strands or so on and so forth. It's not even like that. All it is like how frequently you're dosing. But if they're the only immuno-oncolytic who has this, and they want to make it a source of competitive advantage to whatever extent they can, and whatever extent the oncologist would actually care for it, they're feeding customization bias. So this section of their website is merchandising or bringing attention to the fact that they have this dosing, and the implication being that they can better treat all their patients by customizing the dose. And now, the trade-off for the physician is it really worth it? Trying to do all this monitoring and figuring out what dose to use, or I kind of sort of, based on my experience, I always start low and go slow, whatever their attitude is. That's the trade-off that the physician has to make. The brand is basically trying to use dosing flexibility as an advantage based on customization bias. Another brand that also does that, and in fact does even more in this area, is Lyrica. So these are several screenshots from a lengthy section on Lyrica's website, where you can see, now Lyrica actually has several different strands, and it has a titration schedule that they want physicians to ideally follow. In the clinical trials, they must have seen that if you do titrate patients to a higher dose, there is a significant impact on efficacy. In the real world, if they are finding that lots of physicians are not following the titration schedule the way they can and should, and therefore almost suboptimally delivering efficacy to their own patients, Now, how do you message to physicians so that you can get them to change behavior, get them to better understand and appreciate that it's not just dosing flexibility option, it's by customizing the dose at the right strength for each patient, you can actually achieve the best balance between safety and efficacy and get as many of your patients to ideal or optimal efficacy as possible. So these are only a few screenshots from Lyrica's website. They actually have more messaging and even more data along on this topic, but this is another example of trying to leverage customization bias for a pharmaceutical brand. So as always we do at the end of a masterclass, let's do a quick recap of what we have learned. We learned 2 heuristics today. Using a number of examples, we've kind of introduced attentional bias and customization bias to you. As a recap, attentional bias, what is it? It's a bias that makes us want to pay more attention to emotional imagery than rational data and rational arguments, and can perhaps influence our decision making in strange ways because of this bias. Customization bias, and all of you might have seen another example would be the Coke. You can write your name or your name is potentially on the bottle. If somebody rationally thought about that, like, what difference does it make? I mean, what's the point of that, right? Like rationally, you would say that that's the silliest idea that they could ever come up with, but it's actually been quite successful for Coca-Cola as a campaign to personalize the label and either write your name on it or but potentially have a Coke out there with your name on it already. And that's another use of customization bias. Customization is desirable or preferred even when it is not necessarily needed or required. Most of the times you would be feeding these biases through your marketing efforts, through your advertising, through your messaging, whether it's to physicians or patients. But there could be other times when you might be fighting these biases in that if you have a one-size-fits-all solution, that now you want to actually say you don't need customization. Like, here's an example, like on-the-spot example. Everybody knows this brand, Tempur-Pedic mattresses, right? Before Tempur-Pedic entered the category, mattresses there were so many different kinds, so many different types of variables, the number of springs, the number of layers, all of this stuff. And Tempur-Pedic entered the category and completely transformed it. All they had was one big, thick block of NASA foam, and that was it, right? That's all you needed to basically get comfortable sleep. So sometimes you are fighting customization bias, other times you're feeding it. It all depends on what brand and category you're working in. So to give you some guidance or pointers on, would either one of these biases be helpful to you, and when they might apply to something you're working on? Here's some, this is not the entire list, but here's some, kind of starting point thoughts or guidance for you. Let's do attentional bias first. For physicians, where are you likely going to see attentional bias affect decision making, and where can you leverage it to your advantage? We've listed the types of situations or types of disease states where you're most likely going to be using attentional bias, where the mortality rates are high, death is inevitable, rare diseases where progression can be rapid or irreversible, like multiple sclerosis, like rheumatoid arthritis, etc., where immediate patient relief is a priority because the patient's been suffering for a long time or it's highly symptomatic. There's prior, failures like on other therapies, and patients can be very frustrated. These are, and you can now that you know attentional bias, what it is and how it's potentially driving decision making, you might be able to think of other other situations where attentional bias might actually come into the picture in terms of influencing decision making. On the patient side, there is a similar set of you're looking for the same types of circumstances and situations where the patients have, like it's a disease where patients can, repeatedly recurrence of the disease or symptomology, where there's some, serious complications can happen as a result of uncontrolled disease, where lifestyle can be significantly or permanently impacted as a result of the condition. There can be significant caregiver burden that can also create lots of emotional situations that both the family has to deal with. ADHD or autism or whatever, like there's many of these conditions like that. And we talked about in where customization is going to will likely occur and where you'll be able to leverage it. Customization bias in the pharmaceutical industry compared to some other industries is a little less common or a little less prevalent, simply because of the nature of how the pharmaceutical industry operates. But even then, disease states or drugs that do have variable or flexible dosing, where maybe there are other ways to modify therapy from one patient to another, those types of options exist. It could be in medical device and diagnostics, or surgical surgeries, like there's possibilities of customization bias affecting decision making. Increasingly in oncology and others, many of the conditions, you are seeing that biomarker tests are becoming more common, and the whole advent of personalized medicine is using based on biomarker tests or genetic tests or other tests is going to only bring more customization into the picture. And on the patient side, depending on as again personalized medicine becomes more real, depending on the weight or the BMI or the other blood values or whatever of the patient, there can be dose adjustments or perhaps even different brands. So for example, if anybody's worked in the anticoagulation category, Eliquis versus Xarelto, Eliquis has in their label, their renal dose is actually linked to the weight of the patient. So there are new opportunities emerging where customization bias can be leveraged to gain more competitive advantage with physicians or patients by a brand. And there are also more and more increasing use of beyond the pill programs, where whether it's patient support programs and services, nurse navigators, any of the other financial assistance and other things that are being offered, those are now creating additional opportunities for pharmaceutical brands to leverage or feed customization bias in their marketing efforts, so as to make the patient feel or the physician feel that they are getting something special. Is really what you're trying to communicate. So that's where we'll stop today for today's masterclass. This was, as a quick recap, we reviewed two biases: attentional bias and customization bias, and discussed how they can affect decision making in the pharmaceutical industry, and how to potentially leverage it to your advantage depending on the brand and the disease state you're working in. I'll pause here. Thank you for joining this masterclass. Until next month, we'll be introducing two new heuristics. Hopefully you get a chance to utilize either one of these, and if you do have questions or experiences that you can share back with us about how you used it or struggle to use it, it's something that always helps us improve the classes in the future. Thank you again for joining.